as you know, we will talk about oral prevention, so I cannot widen the subject. We could talk for hours and days, but we give only the mouth a chance. And I can ask, what is your goal with your teeth? So where do you stand with your teeth? How many teeth do you have still? And we can ask ourselves, what can I, as personally, me, I also as a patient, but I also as a professional, or what can you do as a patient to, really practice prevention? And how will it work? So this is going to be for the next half an hour, the theme. And you see a little family here. This is Rebecca with her sons. And interestingly, I didn't know this young lady when she was as young as the little boys now. So I know her since she's 7 months old. And I do know her teeth since she got the new teeth. So when I got to know her, she had not even one. So she started to have your new teeth, and she changed the teeth to her regular teeth. I continued knowing her as a patient because I know her mom, and I took care of her mom teeth. And now I take care of her children teeth. And it's interesting, and it's really very nice to have this profession to accompany these patients all through her life and see how the children get children and how we start with the teeth and how do they get or get protected or they don't get sick. So we talk about prevention means, when we talk about prevention, that means to me that we look after the teeth, that they don't get sick. And we will talk about what can get thick in your mouth. Is it only the tooth or it's also the gums? So we will talk about that. But I can tell that Rebecca had never caries and never gum problems. And even her young children do not have a problem. There is one problem we have at the moment with younger children, but I do not talk about that. That's a really advanced subject. It's that they get born and the teeth interrupt to the mouth with already defects. That's the cheese teeth or the calculus teeth or hypomineralization teeth. So this is a special theme, and I will not talk about that because it doesn't matter the adults. So, but as you know now, with our influence of the around, we do know that even children already get born and the teeth interrupt into the mouth, in the cavity with thickness. So that is also a problem. So we start, good health starts with a healthy mouth. So if we talk about a healthy mouth, we talk about a healthy body. And actually it is the door to your body. So your dentist already sees a lot. And if you look now at your teeth, and I will check that if I can, the PowerPoint, you see here healthy teeth. This is a young lady, 19 years old, I will say. I didn't know her already since she is born. She is the daughter of my best friend. And I do know her teeth, and I took care of her teeth. And she also has no caries, never ever. And she doesn't have any gum problems. She has perfect teeth. What she has, and you will see as a dentist, sometimes you can use your teeth when you use them when they go together and the function is not perfect. Sometimes you reuse, and you see that on the picture on the right hand side. Let me do that. I see here the laser pointer, and I get the laser pointer, and you will see here this tooth. Can you see it?
Yes.
It's, yeah. This is what we call abrasion. So this means when teeth on teeth get together and the orthodontic function is not perfect. So she's 19 and she already damaged her teeth. But this is not a caries problem. So we do actually talk about a non-carious problem of the teeth. So we have a lot of non-carious problems, the erosion, for example. When you have drinks like Red Bull or something like that, too many acid, then you have erosions. But this is not the subject today. I just want to tell you, if you want to know if your gums are healthy, you have to know that gums here like a triangle between your teeth. Like, can you see that? It's a triangle. It should not bleed. Bleeding gums means they are not healthy. They are sick. And we will discuss about these two sickness or these two problems is the gingivitis and the periodontitis. I will distinguish between these two sickness, between these two problems. But we also talk about the tooth. This is the white part. Like I said, we will talk about caries, but she doesn't have caries, but she has this non-caries problem that she uses it too much, but her orthodontic thing is not perfect. So somebody wants to get in, Wenxi?
Yeah.
So good health starts with a healthy mouth. The rules are very easy. And actually the rules, so when you are interested in keeping the teeth of your children healthy, that's very easy in our case. But the problem is that we as adults, we are mainly not healthy. 80 to 90% have gum problems. Not even the foreigners, also the Germans, the Austrians, all over the world. 80 to 90%. But why? We will talk a little bit about. So next thing is that when we talk about how to take care of your teeth with the healthy habits, we will talk about what we eat and drink, and our hygiene habits play an important role in the development and protection of teeth and gums. So these are the three things: eating and drinking and hygiene habits. If you get that, if you understand that, the influence of eating, the influence of drinking, and the influence of how do you brush your teeth, that's what we are going to talk about. The most important nutrition for good health, dental health, are mainly found in, we all know that, fruits, vegetables, and dairy products. That's very interesting. Actually, we would know it, but what we get in our supermarkets is not only fruits, vegetables, and dairy products, right? We get other processed food. We get other things. So we have two people in our waiting room. Just want to tell you, Wenxi. So when you start and talk about the very important thing to have healthy teeth, the hygiene habits, because the hygiene habits are easily to teach. I tell you, to talk about what we eat and drink is very complex, and it goes into the daily life routine. It goes in how you were raised and what is your favorite food or not. So this is very complex. And in the dental office, we avoid to speak about that because it's very complex and it has to do with you as a person. So, but we can talk in a dental office about our hygiene habits. And I want to tell you about teach from a young age to brush your teeth. So when you have children, start in a young age that it is training how you wash your hair, how you wash your nails, your body, you get a shower every day. So as well, you have to brush your teeth. Like you clean your dishes, you clean your teeth because you use them. So after every meal and especially before going to bed. It's a basic, actually, we do it. But the problem is that we don't brush 2 minutes. Or maybe we brush, 1 minute or half a minute. So that's
we
the problem.
brushed not correct places, like between the teeth, which is super important.
Yes, that's the next point. So we are on the basics, and I will talk about that later, about in between. But at least about the time of brushing should be between 2, and if you have already a problem, 3 to 4 minutes. you know. So if you're healthy already and your dentist says, oh, you're very good, no problem. So you can talk about the 2 minutes. But if you have a problem, you have to raise the amount of time. So to take care of it, it's like when you have a car, if it's new, you don't have to take care of it a lot. You just put in gasoline and you drive. But when your car is 10 years or 20 years old, you have to replace things. You have to take care more. You give them more oil, you give them more treatment, you give them more care. And so it is as in our body, when our body gets old, we should take care more. So change your brush every 3 months. That's a basic thing, that we don't use our brush for 1 year. But then also use toothbrushes and toothpastes appropriate to age of the child or adult. And here it's a main point that we talk about children mainly have a caries problem, but adults do not have a caries problem. They have actually a gum problem. So your dentist should talk about your problem. They should have a diagnostic. They would say, okay, Vanksy, or okay, Petra, yeah, I've seen bleeding your gums. Please, let's do a treatment. Let's do something against it. Not, oh, yeah, that's normal. Everyone bleeds. That's not correct. Because in the gingivitis, we start to a periodontitis. There's no periodontitis without a gingivitis. So always the bridge is the gingivitis. And we have the problem under professionals as well, that they do not talk about gingivitis. They think, that's normal. Right, Vanksy?
Yeah. This is one thing with many dentists that have not specifically educated in periodontal disease and gingivitis, is that they themselves don't know how to treat it.
Yeah.
So
Perfect.
they don't talk about it.
Yeah,
because
that's perfect.
You
got it right, Vanksy. You got it right.
You have to send them somewhere else.
Yeah, that's why actually, Vanksy, we call him the dentist. So he's in German, it's a Zahnarzt. So he takes care of the teeth and not about the gums. And actually at the university, they do not learn a lot about the gums, only in the last 20 years. And like there are countries like Finland, Norway, they're once ahead of that. They do know how important the gums is. I say always, like, it's the foundation of the house is more important than the house itself. So what you have a very nice house, a perfect house. It was very, it costs a lot of money. But when the foundation is not stable, you lose the house on sand. It doesn't work. So I say the foundation, it's actually the gums, and the bone is more important than the tooth itself. So that's why I say these are basics, but we have to talk, when we talk about gums, and we do know that, we talk about the interdental cleaning. We don't talk about when you have brackets, for example, you need to clean them. You need to clean the interdental room. So I show you here. You see here the interdental room, see here? And it starts to bleed here between the teeth. Here you come on with the brush, that works perfect. But not many people do know how to clean in between. And you have here, how do you call it in English? Zahnseide in German? I don't hear you.
Dental floss.
Dental floss. Okay, sorry. The dental floss or the interdental brush. So my patients, because I'm specialized in gum diseases, I mainly work and train my patients. And this is a thing we talked about before we started the meeting, that this is a training. So when you go to the dentist, you go to the prophylaxis, you go to a person who is trained to train you. So actually the dentist has no time. So he is doing the drilling and the filling and the billing, for example. But if you do prevention means you get trained how to use your brush, how to use your dental floss, how to use your interdental brush. And I say this is the main part to talk about. If the patient does not do that, I had to work in an office today, and I had to train the wife of the dentist to use the interdental brush. So nobody liked to talk to her about that. And it's very important. It is the most important thing, because outside and inside to clean your teeth, it's normal. Everyone does that. We get trained from our parents, but nobody tells us that we have to clean in between. That's the most important thing. So you only clean when you only brush your teeth 50% of your teeth and not 100. So when you clean your spoon or knife, you clean both sides and not only one side, right? So you want to have clean teeth, you do that at home. So we do our profession in the office, but you come to us maybe 2 times a year or 3 times a year, sometimes 4 times a year, but it costs money, actually. This is very expensive. So better do it at home. When you do the job, I do my job. But if you come and I have to clean the things you haven't done, it costs a lot. That sometimes it's not good, because people say, oh, it hurts, it's not nice, I do not want to go. But you go because you're sick, you have a problem. Then it's a treatment. So we talk about that later. What you see next, it shouldn't be disturbing, but you see here, this child is not even 10 years old. What happens? How do teeth get damaged? Why didn't the parents take care? But the child, it's not the problem of the child. The children till 12 or 13 or 14 years old should be under the supervision of the parents. So actually, I do need to talk about that problem with the parents. They didn't supervise the cleaning of their child. This is a girl, and I had to call the parents and tell, why didn't you clean properly her teeth? Yeah, they said she has to do it. No, it's you. You should advise and you should supervise the cleaning of your child. This is not the problem. Or you take her to the dentist, because now she has caries. See it? Now she has gum problems. No hygiene habits, cavities and gum diseases are occurring. And for example, it's going to be, and it is also, like we said, the nutrition problem. I'm sure she doesn't eat properly. This is a sugar problem. This is also, gum diseases are also a problem of not eating healthy. So it's very interesting. Gingivitis has a connection with your eating habits, with your body weight, and with your blood sugar. Very interesting. I will talk about that later. So how teeth get damaged? No oral hygiene, cavities and gum diseases are occurring. The cause? The biofilm, you see it here. Dental bacterial plaque producing acid. Consequences, it's the caries. So you see here caries. It's a problem of your tooth. Biofilm producing toxins. Consequences, gum diseases. Here you see gum disease, inflammation. So bleeding and bone loss is inflammation. There are measures to avoid this process. So we talk about 2 problems: teeth, caries, and the gums. And the gums have the gingivitis. This can get healthy, reversible, we say in English, in German, reversible. And parodontitis is not reversible. If you lose bone, this is gone. So here you see it again. Biofilm causes gum diseases. This patient has biofilm. Yes. Now I can tell her, why didn't you clean your teeth? I can do that, but this is not fair, because I do not know what's her problem. I do need to talk to her and ask her, and she is still my patient, and we cured her. It's about 8, 9 years ago. And I will tell you, her problem is she was thick. She had leukemia. So she had hard treatments. She had other problems than her teeth. Then she got periodontitis. And then nobody wanted to treat her because she was afraid of the dentist and afraid of doctors because of her trauma with doctors. Do you understand? You have to ask the patient. You have to take care of him. You have to guide him into the process of treatment. And now I will tell you, she is a perfect patient. She has no biofilm at all. She learned, but it's a process. So you have to not come with your fingers and tell, why didn't you brush your teeth? Why didn't you? This is like a school child, and you feel embarrassed and you do not want to talk about that. And nobody wants to get the finger and tell, why didn't you? So we start, it's like a restart. When you come on my chair, I restart. I give you and I tell you, look, this is the problem. We start this and that. I give you the right toothpaste. I give you the treatment. I start to help you. And one thing we do know, when you have biofilm like here, you get also cavities. So this is her X-ray, and she had here caries. This is treatment of the dentist. You understand? When you have caries, this is treatment of the dentist. But when we talk about gum diseases, this is the treatment of the specialized persons in your dental office. Is mainly the dental hygienist or a ZMP, we call it a prophylaxis, but she has to have education, and that's mainly the problem. These are in a salary more expensive. So a dentist needs to contract me, to pay me, because I do my job. And this is sometimes not every dentist has a dental hygienist or have special educated people there. So he needs to give you, how do you say that? Überweisung. So he needs to send you to another dentist who's specialized. This problem can only a specialized office treat. A caries, every dentist can do that, actually. So here you see the solution to avoid caries, to avoid gum diseases, to avoid dental plaque. You need to brush your teeth. Very easy. So to brush your teeth, you need actually not only gargle, because this is the biofilm, and you see the biofilm has here little feet. This is the microcolonies. They attach to your tooth, and when it comes here, they protect themselves, and when you only gargle, for example, they stay. So you need to brush. We need the mechanical treatment, not only the gargle treatment. So if I drink water, the bacterials do not remove. The bacterial biofilm not removes. So he sits there and he gets fed by the carbohydrates. So that means when you eat sugar, when you eat bread, noodles and all that stuff, he eats with like you eat for your body, and he needs it also. So he lives, and then he starts to here to attach. And if we say a ripe biofilm, it's even sometimes hard to brush, because when it starts to get mineralized, we call it calculus, and you cannot remove it. Here, when it's only 24 hours, you can remove it. But when it starts to get calcified, so it means it's calculus, it's calc, Zahnstein, so tartaro, we call it also, tart, you cannot remove it. We do it in our dental office. So actually, when we see that, so this is your daily routine. You remove your biofilm from that things you eat, the bacteria eat as well. They make actually their digestion. They want to stay, so they like glue on your teeth, and it's your job once a day, clean your teeth properly, once a day. You do not have to do it 3 times a day. Once a day, you do a very good cleaning, properly, 2 to 3 minutes. And if you have gums problems, you do it longer, actually. So that is my advice. Okay, I go again. What is your aim? Which tooth do you want to be? I would say we all want to be this one, the smiley one, right? Because here, it's not only it hurts, it costs a lot of money. Drilling, filling, and billing. So if you want to save money, you better brush your teeth. And how do you do that? The best. This is how it works. Protection and reinforcement of the tooth. That means fluoride in your toothpaste. This is the helm. Use brushes and toothpaste to, like we said, mechanical removement. Healthy nutrition and avoid sugar. Very easy, right? Actually. So this is for your daily routine. I do not go into that deeply, but you have your toothbrush, you have your toothpaste or to gargle. There are different, how do you say, the ingredients? You have the interdental cleaning, so you have to get advice from your professional, what is the best for you. You have different fluorides, which one is the best for you. You have pastes like the tooth mousse for special paste, and you have also vanishes, the different. So this is actually the work of your professional. That's why you go to the dentist. The next part is that you need to know tooth decay and gum diseases are 2 of the most common diseases in the world. 50% of the tooth decay and 50% of the gum decay. So 90% have these problems. And it's common nowadays and can be prevented, like I said. How? We talked about the history of the teeth. So it starts, actually, we call it primer prevention. That means actually before you get pregnant, you can do everything. You can have enough vitamin D, calcium, magnesium. So you add all the supplements for your body to start. So the baby teeth, they begin to form in the 2nd month of pregnancy and calcify before birth. So actually the teeth 4 years before they interrupt, they're already in the body of the baby. That's very, very interesting. Permanent teeth, they begin to calcify before birth at the end of the pregnancy, and they are full formed by the time the child is 8 years old. So when they come with 12 years into the mouth, 4 years before, they are already waiting to be there. So we have to take care with enough minerals. So it's very interesting that we still have different forms of caries. We have, this is the first part, the white spot. This is the second part, and this is the nursing bottle syndrome, and this is very late. This already you do not see in Germany, I hope. Yeah. This is other parts of the world, but you still see that in some countries. That has not to be. This you can avoid this. And here you see the different stages. We call it white spot. So if your tooth starts white, you do know he needs treatment. He needs paste, he needs vanishes. And if the dentist says we have an animal caries, we can treat it with a filling, but is not in the pulp. Then you have a dentist caries, and then the cavity with root involvement. You see it here. Here you have a big problem. This needs to be treated. So I talk about the gum diseases. We have the healthy tooth, no tooth problem, no gum problem. We talked about already the gingivitis. This is reversible, but the parodontitis, here we talk about tooth loss. And parodontitis is not diagnosed very often because people don't take it seriously. This is what I do want to give you the message. So here again, bleeding, gingivitis. Gingivitis and caries in a young person, and here you have parodontitis. Parodontitis as a result of loose teeth, sorry. Periodontitis as a result of loose teeth. So when your teeth start to move, you need to do something. You need to go to the dentist, but to specialized dentist. So you always need to know, if you're already sick, you need a treatment. If you're healthy, you can prevent thickness. So tools and techniques of cleaning teeth to avoid diseases. Children do not have the greatest skills to perform a good brushing technique. You need to help them. Please, till 10 or 12, you need to supervise your children. So we start with the Kai technique. That means on the surface, on the top, then außen, we call it in German, outside, and then inside. This is a special technique, the 45 degree, using and cleaning the gums. Yeah, dental brush is to use for at least 2 minutes with the Kai technique. And as a method, fluoride should be in the toothpaste. That's what we recommend. And that means tell, show, and do. So go for a coaching, go for supervising, go to the dentist and ask him, why don't you teach me how to brush my teeth? Healthy and beautiful teeth are very important in life. Take care of them. Healthy teeth, how? Eat the right thing, drink the right thing, and have the right oral hygiene habits. It plays an important role in the development and protection of teeth and gums. From the beginning, it is very important to take good care of them. It's in your hands. That's what I wanted to give as a present for you. And for example, literature, it's very interesting. We do now in our days, when I started my profession 30 years ago, we didn't know that. But now we call it the Ernährungszahnbürste. So the nutrition is even more important than brushing. So that's what we eat. And that's very, very interesting. Periodontitis is not only in your gums. Periodontitis is in your body. It's the inflammation of your body. That's the problem. And we talk about the problem that periodontitis also raises the risk of having problems with your lungs, problems with Schlaganfall, now the stroke, then also a stroke and diabetes. That's a very important thing. Osteoporosis and risk when you're pregnant of having a low birth weight. Yeah? So very important for a young woman. The hormones, like Wenxi told me. It's very interesting. And I'm in the profession, like Wenxi said, for more than 30 years. And it's so interesting. And we still learn. And you see, when you have inflammation here, it's more than a whole hand. It's inflammation. And you would not walk around with an inflammation of the whole hand. But at the gums, we don't take it seriously. And that's the problem. So we call it now duo infernale. So sugar and gums. And I do have here, Wenxi, I will show you. Pfeiloptionen. Automatisch. So I try, freehand. I hold on. Yeah, now it is. If it works, I would have here a little video, right? I started. Maybe, do you see the video, Wenxi?
I think you probably have to stop sharing the PDF.
Yeah.
And
okay, I tried to share it again. Here it is. Yes. Now you see the video?
Yes.
Hold on. I will come here. So you can go on this website. It's from the official board of the periodontology, the German Society of Periodontology. And you have here, you see, for patients. Here, you see it? And I talk about diabetes. I want to know that. And you have here the video about information about diabetes.
In the chat?
Pardon me?
Can you copy paste the link in the chat?
Yes. Perfect. Look. You see the video?
Yes, but I guess we can't hear you because it's being played.
I did not hear you. It's in German, yeah, but I think everyone can translate or.
We can see the video, but we can't hear the.
I don't hear you. Hold on.
Can you copy paste the link into the chat so the guests can find it easier?
Do you see now my PowerPoint again?
Yes.
You see?
Can you hear me?
Yes.
Yeah.
Can you see the PowerPoint again?
Yes.
Do you see my PowerPoint?
Yes.
Yes.
Can you
Okay,
hear me?
perfect. Because on my screen, it is still the other thing, but I have two screens, like we talked about already. Okay, perfect. So this is very important, the duo infernale. So between diabetes, and a lot of persons in our days have diabetes. So you need to control that too. And this, the board of the German Parodontiology is a very important website. So you copied it to the chat for all the listeners, right? And so I invite you all who listen out there to ask me questions, because we're going to come to the end. Like I said, hold on. Here it comes. So that's my final message. Health starts in the mouth. Take good care of it. So that means take care of your healthy nutrition. Take care of what you eat. Clean your teeth twice a day. Also in between. Fluoride in your toothpaste and annual dentist checkup, like we heard in the video as well. So Gesundheit beginnt im Mund in German, or like I said, health starts in the mouth. Take good care of it. I try to give you that message the last half an hour or a little bit more. And we would like to open a discussion, dear Renxi.
Okay, now it's question and answer time. Does anybody have question?
I do not understand.
Can you hear me?
Yes, now, yeah.
Okay. Does anyone have questions? You can type now in the chat, or I could start asking questions.
Yes, please. I wait for the questions.
I'm starting to notice that this kind of correlation between allgemeine medicine, like normal medicine, with dental medicine, is that the periodontologist and prophylaxis are pushing the normal medicine to recognize that there is this correlation. But when I talk to the normal medicine, those doctors, many of them, they don't want to admit that this has a correlation. They say, no, it doesn't exist. They say it's exaggerated.
Yeah, I know, but they will recognize. So sometimes if people have cancer, for example, and they get treatment like Stammzellen treatment or stroke, they do send the patients before they treat to the dentist. So peu à peu. So I would say we are happy about the small steps. So
Yeah.
some of the doctors, they recognize. And I think in 20 years, everyone will know. So it takes time, Maxi.
And I remember that I've talked to a cardiologist, and the answer from the cardiologist is that currently many still think that the dental disease, the bacteria that come in from the mouth, they are not a major cause for the heart problems.
For
But they
what?
are already
For what?
for heart problems like heart attacks and the
Heart
blood
attacks, yeah, stroke, yeah.
in the vessels.
Yeah.
But there are already lots of studies, right? It's
a lot of studies, yes.
I'm very happy to see that there are more of these studies, and
Yeah.
I'm seeing that there's much more development and recognition about this topic in the dental medicine. But in order to make the normal medicine also recognize this part, yeah, it's going to take a while.
A lot of time, but actually we still try to get the message to the normal dentist. You know, we have a lot to do between the dentists because they are not very equal. So we have very good dentists, but we have very bad dentists. They do not care about the gums. So we have a lot of work there too.
And I've had 2 other dentists before in Berlin, and it seems like they don't have dental hygienists in the clinic. So every year I went there and they just cleaned my teeth normally and sent me home. And says, I don't have a problem. I just need to brush better. But that was not correct.
Yeah, that's not correct. And that's the problem. That's mainly the problem. They give the guilt, they blame the patient. It's not always the patient problem. It's sometimes the dentist doesn't do his work properly. We have any questions from the audience?
At the moment, not yet. Does anybody have questions? We have also 3 audience on YouTube, but it's very quiet.
So I answered all the questions about prevention.
Do you want to talk a little bit about Ölziehen? Yeah.
I think it's in English, oil pulling, no?
Yes.
Oil pulling, yeah. This is a special method we can talk about, but I think that the basic actually is to find the right toothpaste. This is one thing. Get a good dentist. I think this is the most important.
It's the most important.
And change the dentist if you're not satisfied. Get a second opinion, I would say. It's very important if you're not. And make yourself check on this official website from the DG Paro, for example. There are a lot of information in the internet. They sometimes, they say, Dr. Google, but sure, Google says me, okay, doctor, you have to do your work as well. Very good. Like I heard that the Chinese medicine only pays the doctor if you're healthy. In the early days, they said that actually a doctor only gets paid when the patient is healthy. It's
I've
not
never
true?
heard about that. It could be
No,
some
never heard
kind of
about that. Because we actually, I think in medicine it should be as well that actually we take care of the health of the teeth, not the of the sickness. But I think maybe someone has a question. We have in the chat one more notice.
So there's also some kind of like Chinese medical treatment, like about how to remove plague and that kind of
What? Remove what?
plague,
Plague, yeah?
biofilm,
Biofilm, yeah.
biofilm
Yeah.
with some kind of salt and a mixture of plant-based powder,
Perfect. Yeah.
but it
Salt,
doesn't work so well.
salt is a disinfection. We use it with meat as well. Salt is perfect. Salted. We had in Austria one toothpaste from a very old dentist 60, 70 years ago, Parodontax. It was with herbs, 4 herbs, and salt, and natrium bicarbonate. Perfect. So salt is perfect. So you actually can mix your own toothpaste. I'm not against it. And herbs, perfect. I think I have one toothpaste, a Pyron. It's 24 herbs. Perfect. I'm happy. I used traditional Chinese medicine. I'm a fan of that. And
Yes,
oil pulling is a good thing, but not only oil pulling. Oil pulling is more if you have inflammation, if you don't have the reason. But I always say you need to go to a good professional to do a diagnosis. Look, if you're at home and do the oil pulling and nobody seen your deep gum pockets, you have a problem. Doesn't heal with oil pulling. That's why I say go to a dentist, get a checkup, and he has to tell you. And if you're not satisfied, like you said, Venksi, you need to change the dentist. I'm sorry for saying that.
Yeah. Okay, we have a question here. So someone likes to eat sugar, and she wants to know that should she brush immediately afterwards, or does she have to wait?
A perfect question. Very good. Actually, we say when you eat sugar, the process of the sugar, when the bacteria eats the sugar and make acid, this is a process, it takes time. So when you eat sugar, you should, when you, for example, at a birthday party, like children, or if you eat sugar when you're out there on a party, or it doesn't matter. You have to know the bacteria needs at least 48 hours to produce acid. So actually, it's better when you go out and know I will go to eat carbohydrates, sugar, brush your teeth before. Brush your teeth properly once a day, and the sugar doesn't harm. The sugar is more the problem on your body. It's a vitamin B, or erupts vitamin B in your body. So if you have for overweight, we know more gum diseases. Sugar for carriers, I think when you're as an adult, it's not a problem. So you need to know you can gargle, you can rinse your mouth with water, etc. This is not the problem. The sugar is when it's longer in your mouth and you have sugar every 10 minutes. So when you eat sugar, eat it once and then rinse your mouth or brush your teeth. You can do that, but then it's gone. Don't eat every 10 minutes. So because we know that the pH drops and then you have a problem. So that's very complex, but a very good question.
Okay, I think there's another question about this is that there's a very old study, a very old study talks about that you should brush your teeth 30 minutes after you eat, but I've taken a look into the study and it was done outside of the body without saliva. So they did this study many years ago, and they came to a conclusion that you should better brush your teeth 30 minutes after you eat something, because from the study, it shows that within the first 30 minutes, the structure of the teeth, the surface of the teeth was not solid.
Yeah,
So
but that's not it talk about erosions.
Yes.
We talk about, that's another thing. That's erosion. So erosione, when I eat fruits, I do not brush my teeth. But now we say more than half an hour. So that's why I said when I go out, I brush my teeth before. When I eat fruits for breakfast, I brush my teeth before. But even then, we should have this pellicle over our tooth. So we do need to have saliva, like you said. You're very right. So that's okay, yeah?
So should we brush immediately, or do we have to wait? Or better just rinse?
Yeah, it depends. It depends what you eat. It depends. But I think for me, I brush my teeth before breakfast. And afterwards, I rinse only like that. And that's it. I don't brush my teeth for lunch. I brush my teeth before I go to bed. And this is not near food. We do not have or to be afraid of eating chocolate and then brush your teeth. That's not right. This is a wrong thinking.
Okay, so you are the
Brush
living
your
proof of
teeth once
this
a day
method.
properly.
Okay, any other questions?
Isn't there one question more?
No, she said,
No?
vielen lieben Dank.
Okay. So you need to know what is your problem. Is it caries, it's erosion, or it's gum? So when you have erosions, it's better you wait with brushing. If you have a gum problem, it's better to remove all the food for the bacteria. So once a day you go with the dental brush. You don't cause problems, like you said, and it depends what you eat. So I think this is the small things. I think you need to know what kind of toothpaste you use. So go to the dentist, ask him, get informed. That's what we try to do or what is your project, Wanxi? What you try to get information. And maybe if someone has a question, they can write to you. I think one more question and then we stop, no?
Yeah, she asks you about your opinions on implant.
Oh, on implants?
Yes.
And what is the question?
Your general opinion.
The general, I would say in our days, so we have implants more than 30 years. It depends.
Is it worth it? Should people do it? I think it depends on the age.
Do you want to replace a normal tooth and put in an implant? No. It's always better to have your own tooth. Do not put. So, but it depends. If you have no teeth, sure, it's the implant. It's a solution. But we say now that the own tooth, to save our own tooth, it's better than to replace it with an implant. Because we do not know it works out with an implant. It's no guarantee.
So, she's talking about, I think she had cavity, and now her dentist is trying to give her either a crown or an implant.
Oh, please choose the crown. Do not choose the implant. No. Because as long as you have your root into your bone, this is naturally. Because an implant, we are not sure if it works or not.
And when you do a crown, make sure that you pick a very good dentist that can completely kill the inside part of your teeth. Because if the dentist can't fix the inside part, can't kill everything like bacteria, it will start to rot inside your bones, and it will create a huge problem.
Yes, and then
doesn't
you
happen
it double expensive.
Yeah, it's going to be double expensive.
So
it will
look,
eat your bones.
Yeah, but this is also I go from when we ask about this question, we need to know what is the situation of the tooth. Is it already, for example, has it a root canal treatment? How is the substance of the tooth? That's very to compare. I think try to get a second opinion or a third. It would be good. Always get a second opinion. But like I say, I cannot give advice. I do not see the x-ray. I'm not a dentist. I talk about prevention. Actually, I would try to go with you to that point that you never need to ask about the question, so that you have your healthy teeth your whole life. You never need an implant. You never need. So prevention means starts before you get sick. Prevention means don't have a decay, never have a gum problem. This is prevention. So I talk about prevention. I'm not a dentist. That's very important.
And she's asking, twice a day to brush your teeth, is that enough?
Yes, more. If we are exactly once a day is enough, but we say twice a day, and I do it twice a day since 30 years, and I haven't had any problem. Twice a day, it's more than enough.
Twice a day, but with the right method, and once a day, which means every 24 hours, use dental floss or the brush to clean. Because as I remember, the biofilm develops in like around 24 hours, and if you can clean it. So twice a day, enough, but do it correctly.
Yes.
Okay, I guess we don't have any questions. Oh, do you recommend any toothpaste? Maybe what you are using?
This is, I was waiting for the question. Like I said already.
I'm going to stop the recording, okay, and stop the streaming so we can...
No, that's no problem for me. But it's always like I said, what is your problem? If we talk about no problems, you can use any toothpaste. It doesn't matter. But if you have problems, you have to, according to your problem. So if you have more decay problem, you need fluorides and need special toothpaste. But if you have gum problems, I would say go more to the herbal, like a Pyron, Colgate, or Meridol, Parodont Expert, as there are very good toothpastes out there. They work really good. But the mechanical part is more important. And if we talk about hand brushing or electrical toothbrushing, you prefer the electrical toothbrushing. And if we talk about Oral-B or Philips, you use actually the one with ultra or Schall. So this is things you can talk to your professional, but I do not know your situation. I do not know the mouth of, I don't know your problem. So it's better, like we talk about skin cream or shampoo. My hair doesn't need different shampoo like Wenxi's. She has different hair than I do. So we do not use the same shampoo, I'm sure. So do you understand? This is not, you cannot say generally this is a good toothpaste. It depends on your problem.
Okay, I think.
Is it? So I think we have done a good job, right? Yeah. What do you think, Wenxi?
Yeah, it was very, very informative, and I like the atmosphere, although we don't have too many audience, but everything is recorded perfectly. Yeah.
Perfect. No, I think next time you start with the project peu à peu, and if someone has a question, you can hand it over to me. I will help you. Like I said, it's it's audience, I don't know you, so better go to your dentist, talk to him, give it a time. Yeah, sometimes it costs something, a professional tooth cleaning. There are costs, but you get something. When you go to get your haircut, you pay. So this is normal in our days.
Oh, what's your opinion between the normal ultrasound cleaning and the new GBT?
What, the new?
The new GBT technique.
Yeah,
The ultrasound
the GBT technique is all a protocol of air flowing and ultrasonic. But we talk about treatment in the professional office. This is a different protocol because you do the how do you call it? The coloring. There's not a name of it. The disclosing. So to see all the plaque, and then you do the airflow, and then you do the TART, so the ultrasonic, and then you do the air flowing again, and that's it. So it's a different protocol, right?
I have very good experience with GBT.
Yes,
I hated the older ultrasound because it was so loud, so painful, and made my teeth completely sore. But with the airflow, it was very
I love the airflow. I use this more than 20 years, so the airflow is perfect. So you're in good hands, Maxi. And one day I get to know you. You come down to the south, and I will see your teeth personally in my dental office. No.
Oh my God.
No. See, now you're no. But I thank you very much for the invitation. It was very nice. Even I don't see anyone, but I think Lisa said already thank you in Chinese. I cannot read that. You translate, Wangxi.
Yeah, she said so. She's using the Meridol toothpaste. I think it's a good brand, trustworthy. And she says, "Thank you very much indeed." Yeah, I was talking to her in Chinese. Yeah.
Perfect.
So thank you very much for joining the project and spending your time with us.
Yes. I like to do that, Wangxi, so we interchange. Thank you for inviting me, and I wish you all a good evening.
Good.
Ciao, Lisa. It was nice to meet you all. Ciao, ciao.
Bye-bye.
Bye-bye.